Attention vacationers and travelers, have you booked a trip to the tropics? Before you take off, there are a few things you should know. Your vacation plans might include relaxation, seeing new beautiful places, and creating memories with friends and family. However, all of those exciting experiences can be ruined by dengue fever, commonly contracted in tropical regions that are home to some of the most popular vacation destinations. It's important to learn about what dengue fever is and how to protect you and your loved ones best so that your getaway can be happy and healthy. So what is dengue fever and why is it so concerning? Dengue fever is a flu-like illness that develops from a virus carried by mosquitoes, which carry the infection between human populations. As a leading cause of death in tropical and subtropical areas of the world, dengue fever can become severe and dangerous. Dengue fever is most commonly found in tropical locations, which are popular vacationing spots because they have ideal conditions for mosquitoes to breed. Falling along the equator, regions of South America, Africa, India, Asia, and Upper Australia all maintain damp conditions that make arthropods dangerous threats to public health.
Who is at risk for contracting dengue fever? Anyone living in or traveling in the Indian subcontinent, Southeastern Asia, the Pacific Islands, the Caribbean, and Central and Southern America. So about 2.5 billion people total. People with weakened and compromised immune systems are also at risk, along with people with prior infection due to the dengue virus. There is increasing severity with every subsequent infection.
The dengue fever virus is one that causes a variety of symptoms that can include a high fever, aches and pains, general upset stomach and vomiting, as well as eye pain and a full body rash. Most cases of dengue fever are resolved in about a week except for other complications. These symptoms only last a week because that's roughly the time it takes for the body to build up an efficient amount of antibodies to combat the virus in the host.
There are currently no vaccinations that you could take before heading out on your tropical vacation, but there are many ways in which you can protect you and your family while you're away from dengue fever. The first is to wear long sleeve shirts and pants so that you can minimize the available skin an infected mosquito can bite. Another item that you should grab as you are packing is bug repellent, which will deter many infected mosquitoes from biting your skin. You should also make sure that your lodging area has windows and door screens that are intact and in good condition. If there are holes or no screens, mosquitoes have the ability to enter into your lodging area and infect you and your family. You should also purchase a mosquito bed net to sleep under each night so that mosquitoes do not have access to your skin while you sleep. If you do contract dengue fever while on vacation, there are currently no medications that you can take in order to combat this virus. It is recommended, though, that you take pain relievers, rest, drink lots of water, and consult your physician immediately.
Dengue does have two possible long-term consequences. Dengue hemorrhagic fever, also known as DHF, is one of these potentially life-threatening complications that occur. DHF has very similar symptoms to dengue, except that after a couple of days, the patient will notice sweating, irritableness, and restlessness. Along with these symptoms also comes normal flu-like symptoms and a fever that can last anywhere from 2 to 7 days. In most cases of DHF, the symptoms will go away after the individual is done having a fever. But in some serious cases, the patient may get significantly more sick and even have circulatory failure, which causes them to go into shock. This state of shock is also known as dengue shock syndrome. Dengue shock syndrome includes smaller patches of blood on the patient's skin or larger patches of blood under the skin. The shock can be deadly to the patient anywhere from 12 to 24 hours from occurring. There's treatment available for people experiencing dengue shock syndrome.